Hey, this is Professor Fay with your anatomy lesson of the day. Today we're going to talk about the skull. Do we look alike? Probably not. I'm going to put the mandible down, that's the bottom jawbone right here, and then we'll talk through some of the cranial bones. So first is the frontal bone. That's the frontal bone right there, your forehead bone. And then it's separated from the next two bones by the coronal suture, which we can see there, that squiggly line. All right, so then the parietal bone sit just posterior to it, and they have their own suture that separates them called the sagittal suture. And if I turn the skull a bit, you can see the frontal bone, the coronal suture, the parietal bone, the sagittal suture. And then we can see this next suture called the squamous suture, which separates the parietal bones from the temporal bone. That temporal bone also extends out right here. We can then look and follow that sagittal suture posteriorly and see that it splits as the lambdoid suture, and then the rest of this bone is called the occipital bone. If we take the skull and make it flip its lid, we can then look at the face, turn it up to the sky, and see a little bit of the ethmoid bone, and then a winged shaped creature in our skull called the sphenoid bone. So those are some of the cranial bones. We'll next talk about the facial bones. So the mandible is one of the facial bones, that's your bottom jaw. And then the top jawbone is the maxilla. The maxilla sort of extends up into the orbit, and it also makes part of the hard palate or the roof of your mouth. If you then take a look towards the cheeks, we get the zygomatic bones. So those form your cheekbones. And then you can also come towards the nose, and you can see the little nasal bones right here, and then the lacrimal bones that have a little faucet in them, a little hole. So when you cry, your tears actually drain down a little duct here into your nose, and so then you have to blow your nose because you're just blowing out tears. So a little pinch is a nasal bone, a bigger pinch is a lacrimal bone, and an even bigger pinch is extension of the maxilla that comes up into the orbit. Then if we look into the nose, we can see the vomer, which is a little wedge-shaped bone that is pretty small anteriorly, but if I flip this around so that you can see the posterior aspect of the nasal cavity, you can see the vomer right here. So it's like kind of a wedge-shaped bone that tapers to just about nothing anteriorly. And then on the wall of the nasal cavity, you can also see the nasal concha, the inferior nasal concha right there and right there. These are little bony outcroppings that kind of hook down towards the bottom of the nasal cavity. Then if I flip this over back to that hard palate, the maxillary bones make up part of the hard palate, and then the palatine bones make up the rest of it. You can see a little suture line between them. So that's part of the maxillary bone here, and then these are the palatine bones. And those are your skull bones for now.